A troubled legacy. Psychiatry's dark past. The history of psychiatry is not always a pretty one. We like to think of medicine as a source of healing and hope. Yet, for much of its past, psychiatry has been intertwined with fear, misunderstanding, and even cruelty. This essay explores the darker side of this history. It's a story of how ignorance and prejudice shaped the treatment of the mentally ill. We'll journey from medieval times to the horrors of the Nazi era. It's a story we must remember, so we can create a better future for mental health care. The roots of misunderstanding, ignorance, and prejudice. These two forces have shaped the way society views mental illness for centuries. For centuries, mental illness was shrouded in mystery, often misunderstood and misinterpreted. People didn't understand what caused it, leading to a myriad of misconceptions and false beliefs. Many believed it was a sign of demonic possession, witchcraft, or divine punishment, ideas that were deeply ingrained in the cultural and religious fabric of the time. These beliefs led to fear and rejection, causing those with mental illness to be shunned by their communities. People with mental illness were often ostracized and even tortured, subjected to inhumane treatments in an attempt to cure them. The lack of knowledge about the brain and behavior fueled this mistreatment, as early medical science had no answers. People couldn't see mental illness like they could see a broken bone, making it harder to understand and accept. This made it easy to dismiss or explain away as a moral failing, rather than a legitimate health issue. Stigma and social norms played a significant role too, reinforcing negative perceptions and treatment. Mental illness was seen as shameful, something to be hidden away, a dark secret within families and communities. This made it difficult for people to seek help, leaving many to suffer in silence and isolation, without the support they desperately needed. Confinement and cruelty. The rise of asylums. As societies became more complex, so too did their responses to mental illness. Asylums emerged as places to house and control the insane. While often presented as havens, many became overcrowded and inhumane. Patients were often subjected to harsh treatments. These included physical restraints, ice baths, and bloodletting. The focus was on control, not care. There was little understanding of mental illness as a medical condition. Asylums became dumping grounds for the unwanted, a place to hide away the problem of mental illness. False hope and experimentation. Early treatments. The 19th century saw the rise of new ideas about mental illness. During this period, the understanding of mental health began to shift significantly. Doctors began to see it as a disease, not a moral failing. This was a revolutionary change in perspective, moving away from the stigma and towards a more scientific approach. This led to the development of new treatments, but many were misguided and even dangerous. The lack of understanding and proper research often resulted in harmful practices. One example is the lobotomy, a procedure that involved severing connections in the brain. It was believed to cure severe mental disorders by altering brain function. While initially hailed as a breakthrough, it often left patients with severe side effects, including personality changes and cognitive impairment. The long-term consequences were devastating for many. Other treatments included insulin, chemotherapy, and electroconvulsive therapy. These methods were also fraught with risks and often caused more harm than good. While ECT is still used today in a modified and more humane form, its early use was often brutal and indiscriminate. The evolution of these treatments highlights the trial and error nature of early psychiatric care. Section 5. The shadow of eugenics, a dangerous ideology. The late 19th and early 20th centuries saw the rise of eugenics, a dangerous ideology that aimed to improve the human race through selective breeding. This pseudoscientific belief was rooted in the idea that certain traits, deemed desirable, could be enhanced, while undesirable traits could be eliminated from the population. This movement had a profound impact on psychiatry, leading to the forced sterilization of thousands of people deemed unfit to reproduce. These individuals were often marginalized and had no say in their fate, their rights stripped away under the guise of scientific progress. People with mental illness were often targeted by eugenicists, seen as a threat to the gene pool. They were labeled as inferior and subjected to inhumane treatments, all in the name of protecting future generations. This dark chapter in history highlights the danger of using science to justify prejudice and discrimination. It serves as a stark reminder of how easily scientific authority can be misused to promote harmful ideologies. The legacy of eugenics is a chilling reminder of how easily scientific ideas can be twisted to serve harmful agendas. Even today, we must remain vigilant against the misuse of science to ensure that such atrocities are never repeated. Section 6. The horrors of the Holocaust. Psychiatry's darkest hour. Perhaps the darkest chapter in the history of psychiatry unfolded during the Nazi era. The Nazis used psychiatry as a tool of oppression and genocide. People with mental illness were among the first groups targeted for extermination. Hundreds of thousands were murdered in gas chambers or through lethal injections. Nazi doctors conducted horrific experiments on patients, often without anesthesia or consent. These atrocities represent the ultimate perversion of psychiatry, a complete abandonment of its ethical and humanitarian obligations. Section 7. A New Era, Reforms and Ongoing Challenges. The horrors of the Holocaust led to a reckoning within psychiatry. The Nuremberg Code, established in 1947, set forth ethical principles for human experimentation. Mental health reforms gained momentum in the mid-20th century with the development of new medications and a greater emphasis on patient rights. However, challenges remain. Coercive measures like involuntary commitment are still used, raising concerns about patient autonomy. Over-medication is another issue, particularly in marginalized communities, and stigma continues to prevent people from seeking help. Section 8. Scars of the Past. Social consequences and stigma. The dark history of psychiatry has left lasting scars on society. Stigma surrounding mental illness persists, leading to discrimination, shame, and a reluctance to seek help. This can have devastating consequences for individuals and families. The legacy of past abuses also contributes to mistrust of mental health professionals and institutions. This can create barriers to accessing care, particularly for communities that have historically been marginalized and mistreated. It's essential to acknowledge and address these ongoing challenges to ensure that everyone has access to quality, compassionate mental health care. Section 9. Learning from history towards a more humane future. The history of psychiatry is a stark reminder of the dangers of ignorance, prejudice, and unchecked power. By understanding the mistakes of the past, we can work towards a future where mental illness is treated with compassion, dignity, and respect. We must continue to challenge stigma, advocate for patient rights, and promote ethical and evidence-based treatments. Only then can we truly fulfill the promise of psychiatry, to alleviate suffering and help people live fuller, more meaningful lives.